The COVID-19 pandemic continues to impact every aspect of our lives, but the question is, how long will it last? In today's To Your Well-Being segment, we are looking at the numbers and if there will be an end to it all. Cone Health's Chief Executive Physician, Dr. Bruce Swords, is with us once again this Monday evening. So, Dr. Swords, we'll start here by asking, how long is COVID-19 expected to be around?
I need a crystal ball, Maddie. I need it, you need it, we all need it. The unsatisfying answer to that is for the foreseeable future. And really what I mean by that, I think most of us who speak to this mean by that, is certainly into the fall, winter, and perhaps the spring. And of course, we're all eagerly awaiting the possibility of a vaccine and perhaps other therapeutics that might impact the disease.
Well, if I find a crystal ball, you will be the first to know about it, so you can really give us a good answer on this. You mentioned the fall and the winter, Dr. Swords. Do you expect that to be a second wave of cases? Is that possible?
We have been saying for a long time that at least at Cone Health, we're not thinking about these as waves anymore. We are in a pandemic. We've essentially had a fair number of patients in our hospitals and our communities with COVID, and it's been reasonably steady with some fluctuations over the past several months. So I'm not anticipating another big wave because we haven't left the last big wave.
So recently it was predicted that the United States could see more than 300,000 deaths by September, a sobering number there. Dr. Swords, do you think that that could actually happen, that we could see 300,000 people die from this?
I wouldn't be surprised if we had 300,000 people die with COVID. When that happens is, for the data scientists to figure out, but I would not be surprised if we have upwards of 300,000 deaths in the United States.
Is there a way to prevent that from happening? What can we do?
Yeah, we get back to the basics here, and I think it is really important for us to just stay with what we know works, and that is stay away from people, wear a mask all the time, wear a mask over your mouth and nose. Don't wear it as a mouth strap or a chin strap. Wear the mask over your mouth and nose, and wash your hands. And if we do those things, we will see success. We've had periods of success, and we've had periods where we haven't seen as much success. And it's typically related to large group gatherings where the success has been thwarted.
And I'm going to need you to get out that crystal ball once again, because you talk about these preventative measures, Dr. Swords, wearing a face mask, social distancing. How long do you see us sticking to those?
I think those parts of what we've adapted to are going to be with us for a while. And again, I would say through the fall and the spring, we will be seeing people wear masks. We'll be encouraging people to stay away from each other. Well into the spring, I think our best guess is the way that will change will be based on when an adequate immunization becomes available.
And you talk more about masks here because, I've seen it on social media at least 3 times a day, people saying the masks don't work. How risky is it to ignore these recommendations and not wear a mask?
I think we have all the data we need that makes it clear that masks work. And we know that when people don't wear masks and when they are in close proximity to each other, the virus spreads like wildfire. We also know that in hospital studies, when people who are infected with coronavirus, and if those people wear a mask and their healthcare providers, physicians, nurses, other clinicians wear a mask, the virus isn't spread. So we know that masks work. I think all of the discussions out in the community about masks not working isn't a worthy conversation. It is important that people wear a mask and wear them appropriately.
6 months into this, I don't think the large majority of the general population thought that we would still be dealing with COVID-19. Dr. Swords, in your opinion, do you think that life will ever be the same?
I think we're going to get back to something much more normal many months from now. That certainly is my hope and desire. And the way to get there is we all have to be community members, play on the same team. Let's knock this thing out and stay away from each other, wear a mask. If we do those things, we'll get back to normalcy reasonably quickly. But everybody has to be playing on the same team.
All right, Dr. Swords, thank you so much for that. By the way, he is sticking around until 6 o'clock tonight, and we are going to switch over into answering your questions. So if you have one, text it to us. The number is right there on your screen, 336-379-5775. We will spend the rest of the half hour working to get your answers. Again, just text that number with your question, 379-5775. We'll see you after this break.